Welcome class to Unit 1, our Introductory Lecture. Today we're going to talk about how to study and how physics is related to what we're going to learn in this class. I'm excited to share this foundational knowledge with you to help you build an understanding of concepts to hopefully make it easier to learn the information you need to learn. This course is a supplemental course to PTA 101. The purpose of this course is to reinforce your knowledge about the PTA 101 topics and give you more background information to give you a deeper understanding of the concepts related to the movement and muscles. This course will also provide basic understanding of anatomy and physiology before learning pathophysiology. When learning how to be a physical therapist assistant, you will need to understand some basic terminology that will enable you to visualize body movements to apply the content to physical therapy interventions. First, we need to talk about how to study. Hopefully, by reading Learning Like a Pro, you're entering your journey with a better understanding of how to study and succeed in the program. In the PTA program, you cannot possibly rely on all rote memorization. You must understand concepts and learn how to apply those concepts to the human body or physical therapy interventions. In this unit, we will discuss physics terms and how they relate to human movement. You do not need an in-depth understanding of physics, so don't freak out. You need to understand how these basic concepts apply to the body or to movement. The human body is arranged symmetrically. In physical therapy, we always document to the exception. This means we document what is abnormal and related to the patient's condition. Here we go. Physics terms. The first one is kinesiology, which is the study of human movement through the application of anatomy, physiology, physics, and mechanics. This is what we are experts in. We are experts in human movement. The next term is mechanics. Mechanics is the study of forces exerted on an object. So in biomechanics, the study of forces exerted on the human body. Kinematics is a branch of mechanics describing the movement of the body without studying how the forces influence the movement. So one of the main concepts that you're going to need to learn is osteokinematic motion. This is the movement a person sees. For example, if a person is kicking a ball, they are performing knee extension. So that motion they see when they kick the ball is osteokinematic motion. Arthrokinematic motion is the movement of the joint surfaces during the joint movement. This is not something you can see. Examples of this is a roll, glide, and spin. Here are the examples of osteokinematic motions. You can see how this person in the picture is moving. Now, in a later lecture, we are going to actually learn what each one of those joint movements are. But you can see the movement on the body. Arthrokinematic motion usually has three types of motions. And these are roll, glide, and spin. So if you look at the picture that's there, you can see how that the little ball is rolling on the cup, and then you can see how that ball glides on the cup, and then how the ball spins on the cup. And we will go into more details with that also in a later lecture. So what I need you to do now is watch Lecture 2, which is on directional terms, before you practice with the activities on Brightspace. Thank you for your attention.